Welcome to everyone. Today's our topic for discussion is cellular adaptations. Before going to the topic, I would like to request you all to like, share and subscribe my YouTube channel Dr. Ravichandra Official Pathology Jewels. What is homeostasis? Metabolic equilibrium actively maintained by several complex biological mechanisms that operate via the autonomic nervous system to offset disrupting changes. When a change, like minor stress, occurs in the body will respond in such a way as to reverse the direction of the change, which is a negative feedback. Because this tendency to keep things constant, it allows us to maintain homeostasis. So, homeostasis is maintaining constancy, balanced, normal equilibrium. What happens when there is more severe stress or injurious stimulus? When a normal cell or a tissue is exposed to an stress or injury, which are a stimulus, then the body cells and tissues will respond in two ways. One, when the stress or the injury or the stimulus is being removed, the cell reverts back to normal. Okay, this is reversible cell injury. Even after removing the stress or injuries or stimulus, if the cell is not reverting back to the normal, but it is going into another phase leading to the death of the cell, then it is called as irreversible cell injury. When the body is trying to accommodate or acclimatize to the stress given, then it is reversible. It can be adaptations or degenerations or accumulations. Irreversible cell injury will always lead to cellular death. The tissues in our body are divided into mainly three classes according to their regenerative capacity. How a cell or tissue adapts to the stress depends on its growth characteristics. So, mainly the types of cells are of belonging to three classes. One is labile cells, stable cells, and permanent cells. Labile, continually renewing, stable, conditionally renewing, permanent, non-renewing. Examples for labile cells are skin, hematopoietic tissues. Examples for stable cells are liver, bone, smooth muscle, and so on. Permanent cells examples are neurons, striated muscles, cardiac muscles. Now coming to adaptations. When a stress or injury or stimulus is given to a cell or tissue, it reacts in a way to accommodate or acclimatize. This is called as adaptation. These adaptations or cellular adaptations can be of four types. One is hyperplasia, other is hypertrophy, other is atrophy, and the last but not the least is metaplasia. First, we will discuss hyperplasia. It comes from a Greek word. Hyper means above, over. Okay. Plasis, that is molding. Cells adapt by increasing their number. So, hyperplasia is cellular adaptation by increasing the number of cells. It depends upon the cell division. So, hyperplasia is seen in labile and stable cells. This hyperplasia may be physiologic or pathologic. Pathologic hyperplasia in some cases may predispose to malignancy. Types of hyperplasia: physiologic hyperplasia, pathologic hyperplasia. Again, this physiologic hyperplasia is, it can be because of compensatory or hormonal. Compensatory example is hyperplasia of remaining kidney following the nephrectomy operation. Okay. Hormonal physiological hyperplasia example is proliferation of the glandular epithelium of the breast during the puberty and pregnancy. Okay. Pathological hyperpressure. It is due to excessive amounts of the hormones, irritation, or trauma because of the growth factors. Example of pathological hyperplasia is endometrial hyperplasia. One more example is viral warts. So, in this picture, we will be able to understand what is hyperplasia more. In the first picture, it is the normal cell, and in the second picture, we are showing a lactating breast. If you see, there is increase in the number of cells. When there is need for the lactation, there is increase in the number of cells. This is physiologic hyperplasia of breast during lactation. The third picture is hyperplasia of prostate, benign prostate hyperplasia, which is more common in men above age 60 years. And one more example is endometrial hyperplasia. Okay, so physiological hyperplasia is physiologic hyperplasia of the breast during lactation and pregnancies. And pathological hyperplasia examples are prostate hyperplasia and endometrial hyperplasia. How this hyperplasia is happening? That is mechanism of hyperplasia. It results from the multiplication of remaining cells or stem cells. Growth factors or hormones will stimulate the cells to multiply. Increased expression of the growth factors and growth factor receptors and signaling pathways and transcription factors will lead to hyperplasia. Hyperplasia is different from neoplasia because uh, neoplasia is a malignant condition, or it is a new growth, whereas hyperplasia is increase in the number of the cells. It is under physiological control and is reversible, whereas neoplasia is not under physiological control and it is a reversible process most of the times. Now we will discuss about hypertrophy. Hyper means over and above, as I said earlier, and trophy means nourishment. Cells or the organs may undergo hypertrophy. Cells adapt by increasing the size. Organs enlarge due to increase in the size as well as the number of its constituent cells. Permanent cells adapt only by hypertrophy. So this hypertrophy may be physiologic or pathologic, and it is induced by increased workload or by hormonal stimulation. Types of hyperplasia is physiological hyperplasia and pathological hyperplasia. In the same way, hypertrophy is also two types, physiologic hypertrophy and pathologic hypertrophy. Physiologic hypertrophy example is muscle enlargement in those who regularly lift heavy weights, muscle enlargement after the strenuous exercise, bodybuilders. Okay, and in pregnancy also there will be enlargement of the uterus, which is due to both because of the hypertrophy and also hyperplasia. Both the increase in number of cells and cell size will happen in pregnancy. Okay, pathologic hypertrophy example is cardiac hypertrophy in a hypertensive patient. Coming to the picture, you can clearly understand by seeing itself there is a increase in the size of the cells. left ventricular hypertrophy in a case of systemic hypertension. Grossly, there is thickened wall of the left ventricle indicated by yellowish arrow. And in the microscopic picture, you can observe the enlarged cardiac myocytes with enlarged nuclei. In cardiac hypertrophy, there is a factor called as atrial natriuretic factor ANF, which is also expressed in ventricles as in the embryonic heart. Mechanism of hypertrophy. Triggers are either mechanical or tropic. Genes encoding for growth factors like TGF beta, transforming growth factor beta, IGF-1, FGF, and growth factor receptors, signal proteins, transcription factors are activated. Switch to more efficient fetal or neonatal protein synthesis may occur. Non-dividing cells adapt to only by hypertrophy. Next important topic, atrophy. Cells or organs may be affected, and it is acquired shrinkage in the cell size due to loss of the cellular substance. When sufficient number of cells are affected, the entire tissue or organ may become reduced in size and becomes atrophic, and it may end in cell death. Atrophy may be physiologic or pathologic. Causes are disuse atrophy because of the decreased workload, denervation atrophy, diminished blood supply, inadequate nutrition, lack of hormones, senile atrophy, and pressure atrophy. Physiologic atrophy, atrophy of breast, uterus after menopause are the classical examples of physiological atrophy. Age-related atrophy of the lymphoid tissue also comes under physiologic atrophy. Pathologic atrophy, atrophy of muscles in poliomyelitis, muscle wasting in cancer or chronic inflammatory diseases, cachexia, comes under the pathologic atrophy. In this picture, you can observe there are normal biceps brachii muscles in the first picture, and there is decrease in the biceps due to muscle atrophy in the second picture. And when you observe the heart, there is in the microscopic picture, there is lipofuscin. Muscle atrophy is the decrease in size and wasting of the muscle tissue. Muscles that lose their nerve supply can atrophy and simply waste away. This is a picture showing the mechanism of atrophy, how it is going to happen. And this is a gross and microscopic pictures showing a atrophy. In the first picture, it was a normal brain, and in the second picture, it is atrophic brain, which is common in Alzheimer's disease. And these are the pictures of the atrophic testes and atrophic hearts. And the microscope is showing lipopigment. Mechanism of atrophy. It is due to increased protein degradation, and it plays a key role. Lysosomal enzymes are the responsible. Ubiquitin proteasome pathway plays a role in degradation of the cytosolic and nuclear proteins. Cell components are also removed by forming autophagic vacuoles. Atrophic tissue shows lipofuscin, which is also called as wear and tear pigment. In organ atrophy, cells are lost through apoptosis. So wear and tear pigment is lipofuscin. It is seen in atrophic tissues. Now coming to the last but not the least adaptation, that is metaplasia. Metaplasis means transformation. Metaplasia is a reversible change in which one adult cell type is replaced by another adult cell type that are better suited to tolerate a specific abnormal environment. However, normal function is lost. It is seen in both epithelial and connective tissues. Metaplasia causes include smoking, acid reflux, stones, vitamin A deficiency, and so on. There are two types of metaplasia. One is columnar metaplasia and the other is squamous metaplasia. If the cells columnar are converted to squamous, then it is the commonest type of metaplasia seen, and it is usually seen in habitual smokers, cigarette smokers. There will be change of respiratory mucosa to squamous type. C. Yes, cigarette smoking, columnar squamous conversion, columnar metaplasia. Squamous to columnar may also occur, and a classical example is acid reflux disease. In this, the lower esophagus may show a gastric or intestinal type of mucosa, which is called as Barrett's esophagus. So, metaplasia, columnar metaplasia, and squamous metaplasia. Columnar metaplasia is the commonest type seen in cigarette smokers, and the squamous to columnar metaplasia is seen in acid reflux disease or Barrett's esophagus. This picture is showing the metaplasia. Here there is, you can observe the gastric metaplasia and also squamous metaplasia in the endocervix. Mechanism of metaplasia. It results from the reprogramming of the stem cells. Cytokines, growth factors, extracellular matrix components all will play a role. Differentiation genes are also involved. Connective tissue metaplasia is less clearly an adaptive response, may sometimes predispose to neoplasia. What are these adaptations? If you see the picture, these four pictures are showing four adaptations. One will be the hyperplasia, one will be the hypertrophy, one will be the metaplasia, and other will be atrophy. The small child picture is atrophy, and the cigarette smoker is metaplasia. And the other two pictures are Arnold Schwarzenegger picture showing the increase in the muscular strength, increase in the cells, okay, hypertrophy. Summary. So when a cell undergoes mitotic division and when there is increase in the number of cells, then it is hyperplasia. When the cell size is increased, it is hypertrophy. When the cell size is decreased, it is atrophy. When one type of cell is converted to another type of cell, it is called as metaplasia. Hyperplasia, hypertrophy, atrophy, they can be physiologic or pathologic. Metaplasia can be epithelial or connective tissue. In the epithelial, again, columnar metaplasia and squamous metaplasia. Thank you for patient listening. Signing off, your Dr. Ravichandra. Like, share, and subscribe Dr. Ravichandra Official for more videos.